the past years. Okay, so people need to engage in various ways of how they can help themselves um, clear this course. So this is one of the ways here. So once you are done here, you go to class or you go and study on your own, so that you cement on the knowledge as you move. Yeah. So last time my colleague said that um, this course is a 3-in-1 course. All right. 3-in-1 meaning it has 3 components in an anatomy itself. So there's gross anatomy, histology, and embryology. All right. So my friend last time explained what each of these components contains. So they will be taught simultaneously. It's not that you learn his gross anatomy on its own for a certain period, and then you start histology, and then you start embryology. No. So, for example, today we're going to have a lecture on gross anatomy. The next lecture, I think, is going to be on histology, and then embryology will come on later on. So my colleague Ferguson will be helping me in some topics, but I am the main tutor in anatomy. So if you need anything, you refer your questions to me. If I'm unavailable, that's when you can go to my colleague Ferguson Lungo. Is my friend. Are we together?
Yes, sir.
Uh, all right. Yeah. So we can start today's lecture. All right. So on gross anatomy. And then the topic is it's just an introduction, which has ways of studying anatomy and nomenclature. Okay, we're together. Okay, so
Yes.
an introduction to anatomy. So, what is this anatomy that people will always talk about? All right, specifically to us medical students. All right. So, anatomy is one of the courses that forms the basis of medicine. You cannot be a doctor without you doing anatomy. Okay, you must know the structures, where they are, and how they look, starting from development in the as a fetus to a fully grown person, so that if there is any derangement somewhere, you as a doctor, you must know. Say, okay, now this is not what things look when they are normal, and then you make a correct diagnosis after that. All right. So it's one of the basic and most important courses in medicine. You cannot be a doctor without this course. You must know human anatomy. You must know the location, the namings of each and every structure in the human body. Okay. So the term anatomy is derived from a Greek word, which is uh, which is called temnen, and then that means what? To cut. Okay. So therefore, the study of anatomy is linked at its roots to dissection, although the dissection of cadavers by students is now being augmented, or in some cases replaced, by viewing prosected material and plastic models, or using computerized teaching models or other learning aids. Okay. So what does this mean? What do we mean here when we say this? What is to dissect? Anyone? And what are cadavers? Anyone with an idea? Okay, so to dissect just simply means to cut. All right. Cadavers are dead human bodies. Okay. So this year, you as second year medical students, you'll be going to the dissection room where you have dead human bodies, which are called cadavers, where you will be cutting to see the structures, each and every structure, every muscle in the human body, you're going to see it. Every nerve, every blood vessel, you're going to see it, and every bone, you're going to see and study. For example, if it's a nerve, you're going to study its course from where it's coming from, which we call the origin, to where it's going, to where it's ending, which we call the insertion, or rather the end of that structure. So each and every structure you're going to see in the dissection room. So this is going to be either you cutting, and that is exactly what is being said here, whether you as a student, in our time we cut ourselves. But last year it was the demonstrators who are cutting on behalf of the students. So this is what prosection means. So in some cases, with this cutting of or dissection of cadavers by students is being replaced by viewing prosected. So this just means if it's prosected,
I can't hear you, Doc. I don't know about the others.
Neither can I hear him
Yeah,
say
same
anything.
here.
so if people have questions, they can just unmute themselves and then.
You went mute for a while, I think for 20 seconds or so.
People to respond. Are we together?
Yes, sir.
We couldn't hear you for a while, I think for 20 seconds or so. We couldn't hear you.
Okay, so where did I end?
On the previous slide.
This one.
Yes.
Okay, so what was I saying exactly? Because I said a lot of things here.
You are talking about demonstrators being the ones that dissect on our behalf.
Okay, so yes, I was saying for this time around, since the numbers are too huge, so it can either that you are going to dissect on your own, or still demonstrators will dissect on your behalf. This is the meaning of the word prosected. So viewing prosected material. So someone dissects on your behalf, and then you.
Sir, I can't get you. You have gone mute again.
Yeah, we can't get you.
We didn't talk about the books to use, so maybe I can use this opportunity to talk about the books. So for gross anatomy, you'll be using Gray's Anatomy for students. There are also books called Thuresia. There is also the atlas called Netter's Atlas. That's the best atlas that you can use. Okay, for histology, there is a book called Janquira, and there are also atlases called that particular atlas is called Eroshenko. I think I'll check out the spelling and then I'll type in the group for that atlas, which you'll be using for histology. Embryology, you'll be using Langman. That's the recommended book for embryology. Okay, so you can proceed. Now you can hear me, right?
Yes, you are audible. So, guys, the books that is mentioning, the books that the doctor is mentioning, they're actually on Google Drive. So, if you have noticed, we have actually synchronized what he talked about concerning the division of the course into three subspecialties. So when you open your Google Drive for HAN2210, you will see that the folders have been divided into three components. And then in those three components, this is where you're going to find the books when you just go into the inside the, 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 the folders. So the books are available. Even the atlases, you're going to find them in gross anatomy. Some of the atlases are in form of videos. Okay, we call them ACLAN. I'm sure you're going to see once you enter the anatomy folder. Then, so stick to the books that he actually mentioned. Guys, stick to the books and then augment, to use simultaneously with the notes that will be sent from the tutors. Okay. All right. Thank you.
All right, thank you, Doc. So we can continue. How can gross anatomy be studied? So since today we're talking about gross anatomy, then this is what we're talking about. Say, how can gross anatomy be studied? So specifically, two ways, which can be regional or systemic. Okay, so you can use the regional approach, and in this approach, each region of the body is studied separately, and all the aspects of that region are studied uh, at the same time. Okay, in the regional way of studying anatomy. So it's regional. We're going to study each region of the body, of the particular part of the body, and then all the aspects of that region are studied. Everything, each and every component of that region. So, for example, if we were to study the thorax, right? If I study the thorax, which is the chest cavity, all the components, all the organs, all the structures, all the muscles, all the nerves, all the arteries of the thorax are going to be studied at the same time. All right. Then we'll move on for another example to the abdomen.
We can't hear you. Your audio reception is bad. We can't get you right now. Hello, we are unable to hear you. Your audio transmission is not so good.
Here. You can as well go to the lower limb. So that's regional. Systemic, here you study system by system. Okay. So we know the kind of system that we have in the human body. We're talking about the human here. So the human body. So for example, if you are to do the systemic approach, if we are to go the systemic approach, we will have, for example, the cardiovascular system. So the cardiovascular system has things like the heart and all the blood vessels that are in the body. So you study from the heart and all the way to the blood vessels. You are done with the cardiovascular system. You go to the nervous system, for example, again, where you have the brain, the spinal cord, and all the other nerves, the peripheral nerves. You get done with this nervous system, and then you go to the other system. For example, the musculoskeletal system, which has the muscles and the bones, just like that. Okay, are we together? Are people
The
understanding what we're
student
saying?
is asking if you can repeat on the regional anatomy.
Okay, so what I said on the regional approach, I said
You said mute.
the heart, the esophagus, and everything, including the bones of the thorax. They're going to be studied. The muscles, the nerves, the blood vessels, just on the thorax. They're going to be studied at the same time. Then you move to the other region of the body. I gave an example of the abdomen again. So the organs of the abdomen will start with the stomach, the liver, the spleen, the pancreas, including their blood supplies, the arteries, the veins, the lymphatics. They're going to be studied at the same time. I gave another example of the region, which is the lower limb. The lower limb, which will include all the muscles as well, the bones and everything about the lower limb will be studied just like that. That's the regional approach. Is it okay now?
Muleng, I can unmute yourself and speak.
Oh, okay. Thank you very much. Does
You
it mean that
mm,
does it mean that this year, throughout the year, we are going only to be doing these things is explaining in gross anatomy, like the regional way of studying it, or maybe the systematic way?
okay?
Which way?
So
Okay.
as Ridgeway, we use regional approach. Okay.
All right.
Yeah, as Ridgeway, we use regional approach. So when you go into the dissection room, you're going to start dissecting from the back of the human body. So from the back, you go to the upper limb. From the upper limb, you go to the thorax, abdomen, pelvis, and then you finish with the lower limb.
Thank you.
Yes, sir. Okay, so
Just to add what he said. So for the lectures they are not regional, they are systemic. You are going to see how he's going to be teaching you. They'll be systemic, they'll be system by system. Okay? So the DR will be regional, the dissections. All right, thank you.
okay. So we go on anatomical position. Okay. So what is anatomical position? They bring questions on on this particular subtopic. All right. So people should pay attention and make sure they understand what we're talking about. Okay. So anatomical position. This is a standard reference position of the body used to describe the location of structures. Okay. It is a central concept behind all the descriptions of the locations of the body. So the human body in its anatomical position is when standing upright with feet together, hands by the side, and face looking forward straight. The mouth is closed and facial expression is neutral. The rim of the bone below the eyes should be in the same horizontal plane as the top of the top opening of the ear. Right? So the palms should face forward with fingers straight down and together, the thumb at 90 degrees to the pad of the fingers. Okay, so this is what we're talking about. Okay, look at that man there, including the lady there. So these people are in the anatomical position. So standing straight, right? Face looking forward and neutral, hands by the side, the palms and the hands by the side of the body. The feet are together like that. Okay, so this image is there in Gray's Anatomy for students, the book. I can see that the words there they're not that visible, but so you can go and check it out in the book. You're going to see this image. Okay, so this is how you position your hands, the thumb, the fingers, just like that in anatomical position. Okay, the way we describe them here. So you're standing upright with feet together, hands by the side, and face looking forward straight. The mouth is closed and facial expression is neutral. Okay. All together? The other thing I need to mention here about the anatomical position is the penis of that man there. All right. Yeah, so that's one of the things that is not in its anatomical position as that man stands there. Okay. So the penis, it should be lying on the abdomen of that man for it to be in its anatomical position. Are people getting me? Are people getting what I'm saying? I'm saying, so the penis of that man should lie, like put it back on the abdomen, because the way it is there, you'll find when you reach there, when you reach the dissections of the pelvis, and then you dissect the penis, you are going to find that the namings of the arteries or the structures in front of this penis, they are being referred as posterior or dorsal. Okay. So the way it is there, you are going to see that the things that are in front there, the way it is, they will be referred to as posterior or dorsal. So in its anatomical position, for it to be dorsal, for it to be correct to say the artery is on top there, they are called posterior or dorsal, the penis should lie on the abdomen so that this top part goes at the back. All right, are we together?
Yes, sir.
All right. So we look at the anatomical planes. So what are anatomical planes? So a plane is just a 2D slice through a 3D space, which can be thought as a glass of sheet. All right. So they are basically different lines used to divide the human body. Are we together? They're just lines used to divide the human body, and they help us uh, name structures or refer to structures, locate structures easier. Okay. So three different types of planes that we will encounter in anatomy this year. So the first one is sagittal, then you have coronal, and then a transverse plane. So the sagittal plane divides the body into left and right. Okay, these sagittal planes, there are many, so they will divide the body into left and right. Okay, and then you're going to have a plane which will pass through the which will divide the body into half. All right, and then this sagittal plane is called the median sagittal plane. Are we together on the planes there? Okay, so there they are on that lady there. Is it the blue one? Yeah, so the blue one there, which divides the body into the left and the right side, is called the sagittal plane. So the one that's dividing exactly into half there is the one that we call the median sagittal plane, because you can have another one that is cutting through, but it's not in the exactly in the middle part, which is not dividing the body equally. Okay, but the one that divides the body equally is called the median sagittal plane. Okay, then the coronal plane, these they divide the body into anterior and posterior parts. Okay, so anterior can also be called frontal or I mean front or ventral. And then posterior can also be called back or dorsal. So you see the way I've arranged this. If you want to use the word anterior, you're supposed to use it the word posterior in reference to another structure. If you're comparing two structures, okay. If you are using the word front, the next word that you're supposed to use is back. If you're using the word ventral, the other word that you're supposed to use is dorsal. So, but they mean the same thing. So anterior, you are using posterior. Front, you're supposed to use it with the back. Ventral, you're supposed to use it with dorsal. Okay, so that plane there, which is in yellow, is the one that divides the body into the anterior aspect and the posterior aspect. All right. If people don't understand, they can pause me and unmute themselves and pause me and then ask their questions. The transverse plane, these they divide the body into the superior aspect and the inferior aspect. The superior aspect can also be called the upper aspect, and the inferior aspect can also be called the lower aspect. So same style here. If you want to use the word superior, comparing with the one structure to the other, then you're supposed to use the word inferior. If you are using the word upper, then the next word they're using is lower. All right? Right. So I assume people are clear on this one, on these planes. So here we go again. In terms of location, if you want to locate something, if you want to pinpoint where this thing is, or sometimes in reference to the other structure, okay, and in most cases it's in reference to the other structure, to say where is this structure exactly in relation to the other structure, to this other structure. Okay, so these are the terms that you encounter: medial versus lateral, anterior versus posterior, superior, inferior, proximal, distal, cranial versus caudal, ipsilateral, contralateral, superficial versus deep. And then you're going to have another one which is rostral. So what do we mean when you say medial? Okay, so medial versus lateral, these are terms we use when relating to how close or further near or further something is to the median sagittal plane. Okay, so we'll compare two structures and then which one is closer to the median sagittal plane. If this one structure is closer than the other, then it's medial. If one structure is further than the other to the median sagittal plane, then it's lateral. Okay, so these terms are used when the human body is in its anatomical position. All right, so medial versus lateral, we'll give an example of the thumb there and the little finger. So the little finger is more near to the median sagittal plane than the thumb. So you would say the little finger is medial to the thumb. Okay. In the same vein, we would say the thumb is lateral to the medial to the little finger. All right. So another example I would give is the nose. Since the median sagittal plane cuts through the nose into half, so we would say the nose is medial than the nose is medial than the eyes. Okay, and then the eyes, they are lateral to the nose. Are we together? Have you seen the examples that I've given?
Yes, sir.
Okay, so anterior versus posterior is the same thing where you're comparing two structures, how close or further they are from the coronal planes. Superior versus inferior, here you're going to relate structures, compare two structures, or how they are, how far they are from the transverse plane, the horizontal plane. Okay, so the transverse plane is also called the horizontal or the axial plane. Those are the other names for the transverse plane: axial or horizontal. Okay, So you superior versus inferior, they describe structures in reference to the vertical axis of the body. Okay. So for example, the head is superior to the shoulders. Okay. That's the best example that I can give. And then the other example that you can give is the knees. The knees, they are inferior to the hip joint because they're below there. Okay. Proximal versus distal. These are used in reference to being closer or further from a structure's origin. Okay, so there will be a point, for example, the elbow joint there will be an origin of a muscle. All right. So from there, you would say, for example, the hand is distal to the elbow joint. Are we together? Cranial or caudal, these are used interchangeably with the superior and inferior there when we're relating them to the transverse or horizontal plane. Okay, so they are basically saying the same things, whether this thing is upper or towards the head, or cranial is towards the head, and the caudal is towards the tail, right? But we don't have tails really, so mostly we use that's why they're being used interchangeably for superior or inferior. Okay, so cranial towards the head, caudal inferiorly here. Okay, ipsilateral versus contralateral. Ipsilateral just means the structures that are on the same side uh, of the body, and then contralateral just means that the structure that you're talking about, they are on the opposite sides. So this can be in reference either to the sagittal planes or the coronal planes, or in the same vein, the transverse planes. Okay. So for example, we would say the one that cuts into half, the transverse plane that cuts into half will cut near the pelvis here. Okay, so we would say the hip joint and the knees are ipsilateral. All right, like they're on the same side. But the hip joint and the shoulders, they are contralateral because they are on opposite ends. They're on different sides. Okay, superficial versus deep or profound. Okay, so here we'll have things how deep or how like superficial is something on the surface. Okay, you are going to have two structures which you'll be comparing. So superficial is something on the surface, and then deep as it is, and then the other word for deep is profound in anatomy. So for example, there are these two muscles that we have on the anterior forearm. Okay, they do the same job. They start from the same origin and end they attach at the same insertion. Okay, so the names of these muscles, mm, flexor digitorum superficialis, that's one of the muscles. Okay, so flexor because it's flexing the arm, digitorum because it attaches to the digits here on the hand, and then superficialis because it's superficial. Okay, the other muscle that is just below it is called flexor digitorum profundus. Okay, so we're just comparing these two muscles that are starting from the same point and ending the same point and doing the same job, but their layers, they're different. The other one is superficial, the other one is deeper. So we're going to have flexor digitorum superficialis. The other one, you're going to have flexor digitorum profundus. Okay, those are the examples that you can give here. Rostro just means how close the structure is to the nose. Okay, so in anatomy, when you hear the word rostro, just means they are talking about the nose. So for example, the forebrain is rostral to the hindbrain, the way in anatomical position. Okay. People can pause me and ask questions if they don't understand. So this is what we're just
Yes,
talking
sir.
about.
Can you?
Yes, yes.
Yes, sir. Can you explain again on the anterior and posterior?
Okay, so you've seen this picture which is here now.
Yes, I can see it, sir.
So we're saying the anterior and posterior, they are in relation to structures in relation to the coronal plane, right? So we're going to cut the body into the anterior aspect or posterior aspect. Okay. Are we together there? So you want me to give examples of structures that are anterior and then structures that are posterior?
Yes, you can. You can give.
Okay. So we're going to give an example of the vertebral column, which is posterior to the breast. So the breast are anterior to the vertebral column. Does that help?
Yes, thank you, sir.
All right. So that's how it is. So this picture we're just talking about cranial, which is near the head. Caudal, we're talking about how low because we don't have tails. Caudal means tails, but we don't have tails. So um, this is in relation to the transverse plane or the horizontal plane. So caudal, how below, cranial, how above. Things near, how near it is to the head. Anterior, posterior, we're just from talking about them. Superior and inferior, that's what we're saying to say they can use interchangeably with cranial and caudal for superior on this purpose only. All right. Proximal, distal, well, we talked about them. Lateral and medial, we also talked about them. Okay, so we're going straight to go and look at terms of movement. Okay, so for terms of movement, we have flexion as the first one. So what do we mean when we say flexion? Okay, flexion at a joint results in a decrease of the angle between two segments that meet at that particular point. Okay, so this is an example of what we're talking about. So you're going to have that your hand there or your arm rather extended like that. Okay. And then when you flex, it means you've decreased the angle. You flexed it there at the elbow joint. So you've decreased the angle of the arm and the forearm there. Okay. So flexion results in the decrease of the angle between two segments that meet at a joint. Okay. So the key word there, you must have a joint and two things that are meeting there, and the angle between those two things are reducing or decreasing. Okay. In contrast, we have extension. Extension will result in an increase of the angle between two segments that meet at a joint. Okay. Again, you must have a joint and two things meeting at that joint. All right. And the angle increasing. Okay. So your arm is stretched like that, and then you extend it. Okay, increasing the angle there at the elbow joint. That's the joint that we're referring to. So you have the joint and you have the arm and the forearm there. Okay. So if the movement occurs beyond the extended position, the action is called the hyperextension. All right. So terms of movement continued. So you
Sir,
have
can you
another
just repeat what you said?
on what?
The extension, I think.
Okay, so there are people in here amongst us, you people there that are so flexible with their bones, right? Those that do more breakdance. Okay, so what I was saying is, if the movement occurs beyond the extended position, this is the extended position. This is the extension that on the second image on your right. That's the extension. Okay, so if the image, I mean, if the movement occurs beyond what you see there, say is the angle has been overextended, okay, the action is what we call hyper extension. Hyper, which means more. Are we together?
Yes, sir. Thank you.
Oh, if you're not very clear, you can still say. Okay, so we
No, sir.
continue.
Okay.
You're clear, right? The other term of movement we're going to look at is abduction. So abduction occurs when a body part is moved away from the midline of the body. Okay, so this midline we're talking about is again the median sagittal plane. Okay, the midline that we're talking about is the median sagittal plane. So when a body part is moved away from the midline of the body, so for example, a shoulder, a hip, or fingers like that. Okay, are we seeing what is happening there? This person here on your left was supposed to be in anatomical position, especially on the hands here. They're not in anatomical position. But let's concentrate on the hip there. What is it? A he or she? This one. What this person does to the hip there. So they have moved their left leg, right, away from the midline. So that's what we're calling. Um, that's what we're calling abduction. This is another example here. The man on your left there, all right? So in anatomical position that like that, then they have moved their hands away from the midline. That's abduction. So the opposite, which is adduction, occurs when a body part is moved towards the midline of the body. Okay, are we together? So the hands were like that in an abducted position. Then you bring them back closer to the median line or the median sagittal plane. So there we're going to have, well, that's what we're going to call adduction. Okay. So in some tests, they're going to ask you to define these terms. So you must know them to say what exactly abduction is all about, adduction is all about. Okay. So one tip that should help you remember is to add, okay, like putting things together. So like you would put whatever structure closer to the midline. So add to your midline. All right. So we'll continue with terms of movement. The next one is inversion. Okay. So this one mostly occurs on the sole here on the feet. Okay. So turning the sole of the foot inwards at the ankle joint. Right. Yeah. So we have the one on the left side, the left image there. That's what we call inversion. So turning the sole of the foot inwards at the ankle joint. So you're going to do it from the ankle joint. Inversion. Eversion is the opposite of inversion. So turning the sole of the foot outwards at the ankle joint. Okay. So the image on the right side there is what is talking about the inversion. So inversion turning inside or inwards. Evasion, outwards. Okay. Elevation is raising a part, all right, to a superior position. So this one can be, we were not restricted here to a sole of the foot, but it can be any other structure of the body, right? So, but the example that we have here is of the same sole of the foot, where they've lifted those toes there, and including almost the whole foot there, right? So elevation. Depression is the opposite of elevation. So lowering a part to an inferior position, right? So elevation, you're going superior. Depression, you're going inferior, right? So there are examples there. So on depression, lowering your shoulders to normal or lower than normal. All right. Okay. These images should help you understand. We have another one called protraction. So in the best example that you can give is sticking your jaw out. That's going to be protraction. Retraction is bringing it back to its normal position. Lateral bending, bending of the spinal cord of the spinal column in the frontal plane to the left or right. So the best example there that we have is side to side at the waist, right? Those that go to do gymnastics, and I think we can relate what we're talking about here. So that's lateral bending, bending side to side at the waist. Okay. Then you have rotation. This simply means movement of a bone around its own axis. This is also known as a pivot. Okay, so for example, the head and the neck and the trunk can pivot around the longitudinal axis. All right. Then you have internal or medial rotation. So this is rotation towards the midline. Okay. You have external rotation. So the rotation away from the midline. So the best example that we can give is this of the leg. So that's medial rotation. Okay. Which can also be called internal rotation, and lateral rotation, external rotation. Okay. So pronation and supination, there are two ways that we need to look at again here. So pronation is rotation of the forearm and the hand to the palms in down position. So you are going to extend your hand like that in anatomical position. That's for pronation. You're going to extend it first and then turn it down. That's the movement that we've made there. We're talking about terms of movement. So the movement that we made there is pronation. So in that same extended position, the way when it's down like that, and then you rotate it, you turn it up. Okay, that's going to be supination. Have people understood what we're talking about? So pronation, just extend one of your arms right now in anatomical position, and then try to rotate it down where the palm faces to the ground. That movement that you've made is a pronation. When you turn it back, to when the palm faces upwards there, that's called supination. All right. So again, they'll ask you to define these terms. One of the ways you're going to remember is there is up in supination. So the rotation of the forearm and the hand to the palms in upward position. That's for supination. Okay. Protraction. This is another example that they're just giving here, and retraction. But in the previous slide we used an example of a jaw. Okay, here they're using an example of a shoulder. Okay, circumduction. So this is a combination of abduction, adduction, flexion, and extension. Okay, so this action describes a circle. So you're going to start moving a point or a structure at a joint, right? At a joint, first you're going to start with abduction. The next thing that you're going to do is abduction. The next thing that you're going to do is flexion. The last thing that you're going to do is extension. So once you move like that in that order, you're going to achieve circumduction. Okay. So there's an example there. Opposition. So this is opposition of the thumb. Okay. The opposition of the thumb is just bringing the thumb towards the fingers. So the little finger, the third finger, the middle finger, and the first finger there. All right. So opposition of the thumb is one of the things that differentiate human beings from monkeys. I also assume that monkeys have 5 fingers, 4 fingers, and the thumb. All right, but monkeys cannot do this thing that humans are able to do, the opposition of the thumb, where you can bring the thumb towards or opposite to the fingers. All right, it's a skill which is learned over time. When it's one of the developmental milestones in children. Okay, when they are born, they will have to learn how to do this, but no one teaches them though. Okay, but with time they learn how to do it, including how to hold a pencil. You can't hold a pencil without you doing position of the thumb. All right, so reposition is just returning the thumb back to its normal anatomical position. Okay, so that's the end of today's lecture. Unless people have questions. Hello? Everything is clear?
Yes, everything's clear.
All right, so thank you for listening and thank you for today. We'll meet again probably on Friday for the second lecture. That will be on histology.
Okay, thank you, sir.
All right, thank you very much.
Doc, I also wanted to ask, are you going to post these notes in the group?
No, we're not posting in the group, but they'll be posted on the Google Drive. That's where you'll find these notes. So again, as a reminder, I'm not. I hope I'm not teaching people for SAPs in here, right? These are normal second years, normal medical students, second years.
Yes.
Yes.
Okay, okay, yeah.
And
So
Doc,
this program is.
oh yeah, I wanted to ask if the same lecture is recorded. Like some of us, we came late, so maybe
Yeah,
if
no
the
problem.
lecture.
The lecture was recorded, and the notes will also be posted on the Google Drive. So you're going to access them there.
All right, thank you,
Both
sir.
the lecture and the notes, they're there. All right.
Okay.
Another question
The,
on the topic on the lecture? People, anything that people didn't understand?
the link to the Google Drive, can you kindly resend it?
Okay. Doc Shadrick.
Yes. The link to the Google Drive folders is everywhere in the WhatsApp groups. So we're just going to forward it again. You are going to see it. Okay.
All right, thank you.
All right. Yes.
All right, so good night, everyone. We'll meet again next time.
All right, sir.